This patient was referred to me for endodontic retreatment of tooth number 14 and endodontic treatment of tooth number 15. He doesn't remember when the root canal on tooth number 14 was done, and he doesn't remember when the crowns were done. Patient states that a few days ago he noticed a little pimple on his gum, went and saw his dentist, and his dentist told him that his teeth were abscessed, and he was referred to us. So take a look here. Let's look at tooth number 14. You can see these these were stainless steel crowns. Actually, this one was stainless steel crown. The other one, I believe, was porcelain crown. I'll show you the pictures. Anyways, you can see a previous root canal, and I mean, if you can even call this a root canal, and you can see this large periapical lucency here. Number 15 also has a periapical lucency associated with it. Now, that's why it's important to take multiple angulation PAs and be able to read those PAs and take a look. So this is one angulation of tooth number 14. You can see short fills and, of course, yeah, just a lousy root canal in general. Okay, so take a look at this angulation here and take a look at this area right there. Pay attention to this area right here. Look at the curvature. All right, again, short fills, just a terrible root canal. So that's the clinical presentation, stainless steel crown, porcelain crown, and look at this right there. That's a elongated fistula, and it's sitting right there. Okay, so that's tooth number 14, tooth number 15, and an elongated fistula right there. So today we went through the stainless steel crown, removed the buildup, and this was a perforation. So the dentist, looks like the dentist was trying to look for the MB canal and perforated right there. So yeah, and he, I guess he tried to use glass ionomer to patch up the perforation. Of course, glass ionomer doesn't work, and it was a mess in there. As soon as I removed that buildup material, that he even used it as a plug into the palatal canal, I had to use ultrasonic to remove all of this glass ionomer material. Used it to plug the distal buccal canal orifice as well, and to some degree here. But I think there was a lot of bleeding, and he couldn't. I'm so glad that he couldn't do it. He couldn't pack all of that into the perforation. But anyways, it was, as soon as I removed this material, it was huge perforation right there, and you can see it. You can see the change in the bone in this area here. That's all bone destruction because of the perforation right there. All right, so remove the gutta percha using chloroform and stainless steel K hand files. And here's the post-op. So you see the difference. As you can see, everything went beautifully. Gutta percha and sealer here, and we repaired this perforation with MTA. This is all MTA right there and right there. So we obturated the coronal 1/3 of the MB canal with MTA, and along with the perforation, this is all filled with MTA here. All right, everything went great, as you can see. Let me show you a different angulation. This is another angulation. Again, you can see that we were able to regain patency in all the canals, and that's the perforation right there. I troughed for an MB2, we wasn't there. And let me show you a different angulation. And this is another angulation, and you can see where that perforation was. The perforation was distal buccal to the MB orifice. So distal and buccal along the same line as the orifice of the distal buccal canal. And that's MTA. That's all MTA, and this is from here to here is all MTA. So we repaired the perforation with MTA, and hopefully Hopefully, we'll see. Temporize the tooth, refer the patient back to his dentist.